Everybody, Dr. Dane, and I want to go over a very important tool that we use in our practice, and that is the Spinal Care Kit. And I have to tell you, this is a key. I look at this as a key to unlock the door to get people into your training facility, to let your trainers work with them. And I actually like the fact that this really looks good with my new blue background. But the Spinal Care Kit, first of all, let me show you what it is. We have this really nice bag, gym bag, and it holds all of the tools for the Spinal Care Kit. We have a half-size foam roller that we'll go over in just a second how we use that. We have one cervical dental roll. We also have one back peanut, and this is not, you don't have to make this anymore. We've been able to find a good, it's called the RAD roller, and it actually comes with exercises in there. And then finally we have a very nice thick band to do the LXTs, okay? Now, we actually build this posture prep into everybody's care plan now. Even 8 weeks wellness patients, we build this into the care plan. And the Spinal Care Kits are $99. We build them in at $149 into the patient's care plan. So we're making a little bit of profit on them. But the real key is, and I was just talking with the doctor today, that the changes that we see with people that are doing really correct form posture prep exercise, and we have a whole protocol. It's in Module M of the 8WW for Doctors site. You can actually go in there and look at all 14 posture preps that we've created. But the difference between the people that do chiropractic care alone and the people that do chiropractic care with posture preps is night and day. Okay, so we've just been building it in everybody's care plan. So we let the trainers know when they have a new client, whether it's going to be a new 8 weeks to wellness client or it's going to be a new chiropractic posture prep client. We also, in terms of the value add for patients, you know, we go over this during the day 2 report of findings. I literally have this bag, guys, sitting underneath my desk. So when I'm going through the patient's care plan and I go through the fact that they failed 3 out of the 4 core flexibility tests and 2 or 3 out of the core strength tests, which they normally do, I talk to them about how important their soft tissue structure is and how important it is that they have good core strength if they're going to make long-term corrections in their spine, because you and I both know that they're never going to make long-term corrections just adjusting them if we don't change the soft tissues of their spine, and particularly the alignment and mobility of the 53 joints in their spine and the muscles that surround that spinal column. So the posture prep was all designed for posture and alignment to really work on core stability and core flexibility. So we let them know in their report of findings that we built these specific exercises. As I'm pulling this out, guys, I show them this is very different, Mark, than any exercise that you've ever done. It's probably different than any type of training that you've ever done because we're going to focus specifically on your condition and your spine. And so we really want to work on your core, and we find that people that have a very strong core, they have a very mobile core, get the best results in our office. And we also find that they hold their adjustments better so that you don't have to be in here, you know, two or three times a week. And the other thing I future pace them with is I find that if people aren't working on their core, as we start to decrease the frequency of their adjustments, they really start to see that their progress comes to a halt and they start to develop the problem again because they've never really corrected the problem. They patched it up for a little bit, but because they lack core strength and core flexibility, they weren't able to lay the foundation for the future. So the posture prep are things that they can do at home to really maintain the correction that we've made, just like a toothbrush and a floss is a dentist tool to give patients to use at home. You know, our tool is the posture prep exercises so that people can do those exercises at home and maintain the correction that we've made when we give them an adjustment. So again, that's just a little bit of background on the posture prep, guys, and the Spinal Care Kits. Please make sure that you're using them. Order them. We put them together. We have a really nice, like I said, 8 weeks to wellness logoed bag. All the tools come in here. Again, your foam roller. We use this on the spine, iliotibial band, hip flexors. I mean, there's just so much that you can do. Think about what a rolling pin does to dough. That's the same thing that this foam roller is doing to a person's soft tissues in their spine. The RAD roller is awesome. Back peanut for thoracic mobility. Lower and upper thoracic mobility, and just to really get mobility into the thoracic joints. We all know what a dental is to restore normal cervical lordosis. And then finally, we have so much application for this band, guys, between doing LXTs, doing deadlifts. I actually do deadlifts with the band to warm up. Just so much. Overhead shoulder press, one arm shoulder press for shoulder mobility. There's just a lot of application. Even I do shoulder pass-throughs with this band. It's a little easier for some people if they can't use the PDC to use just one string of the band because it's a lot easier. So again, just hope you guys understand the utility of the posture prep and the importance of the spinal care kits in recommending your chiropractic care plans.